مرحبا شباب. اليوم راح نبدأ بالمحاضرة السادسة إن شاء الله اللي هي تكملة للمحاضرة السابقة. موضوعنا اليوم حيكون Management of Impacted Teeth, Clinical Evaluation and Removal Procedures. So by the end of this lecture, I'm expecting you guys to know how to classify the difficulty of impacted teeth removal based on radiographical and clinical investigations, and understand the system available in mandibular third molar evaluation. Besides, we have two classification systems for mandibular and maxillary third molars. So by the end of this lecture, I hope that you're gonna absorb it and understand it well. And management of the other impacted teeth also, and understand the steps and principles of surgical procedure. So, first of all, before we do removal of the third molar, and we discussed earlier the indications and contraindications of removal of third molars, now we have to assess the difficulty of removing this impacted tooth. As I mentioned before, we don't need necessarily to extract every impacted tooth. We have always to put things in the scale to see the benefit and the morbidity of doing such procedure. So, the most important thing when we start, let's say we have a patient and we decided to remove the impacted third molar. Now, what do we need to do the surgery? First of all, and furthermost, and the most important thing is always check accessibility. Can me as a dentist or oral surgeon will be able to access to the surgical field without any complications, without any problems? This is the question. So, to do so, we need to check intraorally and take some radiographs like OPT, give us the good idea about what's going on around the impacted tooth. Sometimes if we take a good periapical film can help too. And in case we have in doubt that see the tooth is very closely related to the inferior alveolar nerve canal, then we should go and take the cone beam CT scan, which is the 3D imaging. Okay, so what are the factors that must be analyzed in radiographs? Now we took the radiograph. Let's say we took an OPG. Where should I focus, or what points should I focus on when I examine the radiographs? First of all, we need to see the relation of the impacted tooth to the occlusal plane. And second one, we need to assess the relation of the impacted tooth to the anterior border of the ramus, and angulation, which is, I'm going to take everything in details, and finally, root morphology. Okay, let's now discuss one by one, and we're going to start with the angulation criteria. So, as you can see here, I put some radiographs. Most of them are cut from the OPG. Okay, and putting beside them this diagram sketch just to make things easy for you guys to memorize. So the first criteria we need to focus on, which is the angulation of the impacted tooth, which we call it the Winter's classification system. So angulation, how can we assess that? We need to assess the angulation, or let's say tilting of the impacted, the long axis of the impacted tooth in relation with the adjacent tooth. Let's see, this is the long axis of the impacted 8, and we have to compare it with the long axis of the adjacent. And again, this one with this one. Okay, this is the impacted, this is the 7, sorry, this is the partially impacted third molar, and this is the impacted. Let's do it better. So this is actually the right one, and so in every single case here we have a name to classify the situation. Let's start with this one. MA means mesio-angular impaction, when the long axis of the third molar is mesially tilted toward the second molar. This one is the most commonly seen one among the other 3 forms of impaction, and it's the easiest one to extract. The second one that most commonly happen is the vertical. And again, you can see there is no, that long axis of the impacted third molar is parallel with the long axis of the adjacent tooth. But again, difficulty of removal of this type is harder than this one. The third one that happens, and this one is about 38%, this one is a 43%, this one is the third most commonly happening one, which is the horizontal. And again, I'm assuming, guys, that you see this one is difficult, but if we compare the horizontal with the vertical impaction, the vertical impaction is more difficult to be removed than the horizontal one. Okay, and finally the distal angular impaction. And somebody will say, okay, this one is horizontal, why it's, and this vertical is difficult than the horizontal one? Because sometimes, mostly the crown of the impacted third molar will be interrupted underneath or within the ramus. That's why it's difficult to remove the vertical impacted third molar. Okay. Now, as I said, this angulation, Winter's classification, assess the long axis angulation of the impacted third molar in relation to the long axis of the adjacent tooth, which is the 7 mostly. Classification, we have mesioangular, least difficult, 43% happens. Horizontal 3%, vertical 38%. يعني نسبة وجودهم من ضمن الحالات اللي تم علاجها سابقا، يعني البحث سواه هو. And finally, the distal angular, which is the most difficult. So as you can see, the difficulty increases if you go downward. So the most difficult one is the distal angular. So again, why distal angular impaction is most difficult? Because the tooth has a withdrawal pathway, as I said, that when we try to remove the tooth, it's going to trap it in the mandibular ramus. And sometimes the root of the third molar, impacted third molar, will be very close to the roots of the 7, which adds more difficulties to remove this tooth, this type of impacted tooth. Okay, do we have an extra angulations for the impaction of the third molar? Yes, the answer is yes. We can find maybe you have a buccal, lingual, or palatal. Could be in the palatal direction. Sometimes it's going to be in the transverse. So the tooth is seated in the ramus transversely. So مثل ما تشوفون هنا إنه هذا الocclusal plane of the third molar is facing me. أنا السن قاعد بالعروق بالريمس أو طريقة transverse. So the other classification, which is Pell and Grigori, these two scientists have developed 2 classification systems. One of the first one, and both of them taken the name after them, like Pell and Grigori. The first one assess the relationship of the amount of the crown exposed in relation to the anterior border of the ramus which says in C, this classification system measure the mesiodistal width of the crown an impacted tooth that is covered with the bone of the ramus, and it has 3 classes. مثل ما تشوفون هنا هاي المنطقة لما نسوي لها زوم عندنا الثيرد مولر هذا impacted بس جزء من الكرام attracted by the ramus of the mandible. فهذا هنا راح نقيس نسبة الكمية المغطاة من الكرام بالبون مال الريموس، هي راح تحدد لنا نوع الكلاسيفيكيشن اللي عندي. Okay, so we have 3 classes, class 1, 2, and 3. Please don't get confused with the orthodontic classification. So class 1, we have the mesiodistal width. Mesiodistal width of the crown is completely anterior to the anterior border of the ramus. So let's have a quick look on this one. So as you can see here, this is the crown of the tooth, and it's completely anterior to the anterior border of the ramus. And again, which is a good sign. If the tooth is not erupted yet, it's a good sign it's this third one gonna have a full eruption. The second one, which is the mostly half or more than a half of the tooth of the crown of the impacted molar is embedded in the ramus of the anterior border of the ramus of the mandible. And again, the difficulty of the removal of this one is more than the previous one. And finally, the complete or the tooth is completely within the mandibular ramus, so it's no way to remove it easily. And again, if you wanna difficulty wise, the way we go from class 1 to class 3, the difficulty is gonna be increasing. And again, this is in the second picture. This is the class 1. As we see, if we measure the distance from this side to this side, we're gonna find it's broader than the mesiodistal width of the crown. This class 2 parts, almost half or less of the crown embedded within the ramus or trapped within the ramus of the mandible. And this one is the complete trapment of the tooth with the ramus of the mandible. The same guys have developed another classification system, but now they give it letters, not numbers, like A, B, C. This type of classification system assesses the depth of the impacted tooth compared with the height of the adjacent second molar occlusal plane. So let's have a picture on it here. Let's see. So they do have, like some of you would say, okay, this one is just look like the same as the previous one. No, it's different, because in the previous one we assessed the amount of the crown of the impacted tooth that trapped in relation to the anterior border of the ramus of the mandible. This one we assessed the amount of the exposed crown of the impacted tooth in relation with the occlusal plane of the second molar. So class A, like the crown is almost in relation in the same level with the adjacent second molar. Class B, the crown of the tooth is going to be somewhere between the occlusal plane of the 7 and the cervical line. And class 3, or class C, class 3, it's going to be below the occlusal plane. Sorry, class C, class A, class B. Just ignore this mistake here in the printing of the this slide. So, and again, this is thorough and detailed images about the class A, B, and C. So, as I said earlier, class A and the crown is of the impacted tooth is